Often I get asked, what should I get when I come in? Do I get just a mammogram? Do I need an ultrasound? Am I supposed to have a 3D mammogram? This is an interesting opportunity to show you the differences between the examinations. Normal mammography is considered 2D mammogram. This is an example of a 2D mammogram in a woman with dense breasts. And what you see is it's white and black. And white's the normal fibroglandular tissue of the breast. So when we read this, we look to see if we can see the cancer in the white tissue, and cancer is white and often is difficult to see. So when you have dense breasts, you want to make sure you get an ultrasound. And why would you want an ultrasound? Because on ultrasound, cancer becomes black and it looks different than it does on the mammogram. And it gives you an opportunity to see things that you can't see on a mammogram. So here's an example of a cancer on the ultrasound. And you can see here that this is cancer. You see it disturbs the normal planes of the breast. And that large cancer is difficult to see here. I've circled it, but does this look any different than this? And often that's the reason dense breasts need breast ultrasound. The new modality now is 3D mammogram. And this is a 3D mammogram right here. And this is this image in 3D. And let's take an opportunity to look at what 3D does. 3D takes numerous images of the breast and allows you to watch them every millimeter of the breast. So we're going to look at this breast in 3D, and we're going to see if we see the cancer. Here's one cancer, and here's the second cancer. This is the cancer that was not seen originally on the mammogram, was found on the ultrasound, and now seen on 3D. 3D ultrasound shows a complete summation of the ultrasound images and allows you to see the cancer definitively, much more blatantly, and also find smaller cancers. So this is an example of someone who had two cancers in her breast, one that we saw for sure on the mammogram, one that took the ultrasound, or a 3D mammogram to see the second one, which we see here, very well demonstrated on the 3D. So when you have a dense breast where you have a lot of fibroglandular tissue, screening ultrasound is an important adjunct study to your yearly examination.